And so there are some if you do have questions or comments, please input them in via chat. As we mentioned, there is in the invitation, you can get 1 hour of CPE for this. The 2 requirements are you need to participate or you need to be involved in the duration of this website and answer the 3 questions and the various intervals during this presentation. You'll get your CPE certificate within 2 weeks, and the survey will be forwarded to you after this webcast. So with that said, I'm turning this over to Matt to kick us off in introductions. Thanks, Matt.
Good deal. Good afternoon, everybody. Thank you so much for joining. I'm Matt Kumper, one of the founders of Veracity Consulting, which is an RGP company, also one of the leads in our healthcare practice. I've got around 20 years of experience in healthcare consulting, primarily in the payer space, although done quite a bit in the last 10 or 12 years in the integrated delivery network space. So the convergence of payers and providers, located in Richmond, Virginia, sitting next to Thomas Pace here. Thomas.
Hey guys, my name is Thomas Pace. I've been a consultant for roughly 20 years, focusing probably the last 17, specifically on healthcare, really all over the board from a healthcare perspective. Again, still focused on the payer side, but again, some provider experience as well, but really focusing on, kind of business and operations, program management, all the way through kind of quality assurance methodology. I've spent a lot of time in the last couple of years in really the digital space as well. So a lot of the, applications and portals and mobile instances that provide healthcare, whether it's provider or payer, have been kind of a lot of the stuff I've worked on the last couple of years. All right, so now we've got to the introductions here. So we want to talk about key takeaways first. So today we're going to go through, a structured, initiation approach for pulling out, functional, value out of the healthcare value chain, right? And to avoid surprises during execution. The key thing here is, it's broken into kind of 3 components, right? So we have our operational component, which is going to drive, the functional kind of pieces that we're trying to push forward and it really get us to our detailed requirements from our high level kind of idea or ideation. From there, that's going to allow us to kind of build our business case. So that's going to, have, various inputs that we'll talk throughout this session that are going to help drive our decision making, right? So there's going to be different components from both a need perspective, but also a financial perspective. That ultimately drive our prioritization and our decision of whether to forward or not. And then part of that is, making sure that for this to work, we have a standard approach, a kind of repeatable model to, take on these challenges and try to work towards, an existing kind of decision-making point for our portfolio.
So in looking at this slide, any particular entity as a single entity within the overall healthcare value chain, there are many functions within your ecosystem that you're able to control. But there are many functions outside of your ecosystem that you're going to need to collaborate and or coordinate with other players. So in this diagram, we're showing at a really, really high level the collision of 3 key ecosystems within the healthcare value chain, right? So there's plenty other collisions that happen in healthcare, which makes healthcare so interesting and complex. But for purposes of illustrating the complexities, I've focused just on these 3. And so, while understanding the impacts within your operational ecosystem is critical, it really is important to consider those outside of your ecosystem as well, particularly when you're taking on any sort of initiatives that might have impacts to those external areas.
Yeah, and so for example, say we have an ambulatory care center and we decided we wanted to purchase and introduce a new piece of equipment. It's a new heart monitoring device that, currently with our current, ambulance setup, we can't support this type of monitoring without this equipment. So we recognize that, but it's not as simple as just buying something and putting it into the ambulance, right? So we need to understand things like facilities management, how we're going to report the usage of that tool, how we're going to integrate into our electronic health records, what our training is going to look like how fast we're going to get back our investment on that product, But again, all the detailed things that are going to drive the value of that product, right? But then also think about things that are going to impact scheduling. So how long before we can get this piece of equipment implemented? Who's going to do it? So care and case management, who's going to actually be able to use the tool? How are we going to bill patients for use of this tool? And any kind of maintenance around feed contracts. And again, that's just one example of a very specific product.
And so, what we've experienced is that, and have seen within our clients is, a large number of projects result in failure. In fact, research is suggesting that over 50% of businesses experience failed projects. They may start off with a great idea, the right intentions, but as things get going, mistakes are made, communications break down, deadlines and budgets change. Maybe the estimated timelines were way off, and by the time the project is complete, we missed a market opportunity, or maybe the requirements were not at a detailed level, and we weren't able to get good estimates because they were such high level requirements, and it resulted in a super high cost initiative that rendered us upside down in the ROI model. So there could be many different causes for project failure, but the methodology we want to talk through today will help reduce some of those failure rates through a rapid execution exercise. Rapid evaluation exercise. And so with this illustration that you see here with the bucket, let's assume that the water going into the bucket represents resources, time, and money. And let's assume that the bucket itself represents a project, right? And the idea is to maintain that full bucket of water and using the same number of resources that you started with. So if you have a project where there's a bunch of holes or gaps due to the many different possible causes that we discussed earlier, it would result in a constant influx of time, resources, and money. If, however, we could ask the right questions early, we can actually help reduce those holes and therefore, require less influx of additional resources, time, and money as we go.
Yeah, and so part of that decision making is it's understanding what questions are in front of us, right? So one of the very first things that we're doing when the idea essentially is presented is, does this project align with corporate objectives and strategies, right? So is this something that is going to drive, if the company has decided, hey, we're going green, and we're doing all this work to make our technology more green, and that's a corporate objective, right? So is this project that you're standing up aligned with that? Or are there other corporate objectives that may apply, right? You want to make sure you have a solid alignment there, and we'll kind of get to that why that's a problem later. But it's going to really be key that you have ownership and making sure everybody's on the same page. With that goes into the second piece, which is, are the correct people involved, right? So I may have an idea that I give to my boss, and my boss runs with it, but it may not be my area that I work in. It may just be something that I saw, on my phone, or something that made me think of a new idea. And it's fine if we run with that idea, but we've got to make sure that somebody's going to own that and make sure that our investment decisions of who's going to pay for it, who's going to do the work, that we have a solid owner and solid alignment with those folks, right? The third thing here is with our benefits from this work. So whether the project's a product, whether it's a change in something that exists, the benefits that we're receiving from this change, are they measurable? Are they reliable? So are they things that are just guesses, like, yeah, we think it's going to be this many people, we think it's going to be this many widgets? Or is it something like, hey, we know if we make this change, it's going to increase our enrollment by 20%, right? So something that's measurable, because you can go back and look at enrollment numbers and validate the change. So, and then kind of once you're kind of past that, now you're into more of the mode of, is it clear to your business executives what you're doing, right? So you identify kind of your potential benefits, your objectives, the people that you want involved, but is it really clear to business executives what they're signing up for? And then, on top of that, you have your costs, right? So the cost of the work, and the timeline, right? So everybody wants everything immediately due, tomorrow. And so, but one of the things that you have to consider is time and money, right? So in some cases, projects, will have an initial estimated cost. And then as time runs through, as open questions are dealt with, the cost gets out of control, right? So one of the things that you need to make sure of when you're setting up this kind of decision making with portfolios is really make sure that those costs and those timelines are reliable. They're not just pie in the sky. They're not 20% type confidence. They're very confident that, hey, we can do these things in this budget. The other thing here that what you're looking out for is, so we've got our project, we know when we think we're doing it, does it impact or conflict with other initiatives, right? So you're maybe changing how enrollment works or changing how the claims process. Well, there may be a reporting team that uses that claim system to report on their work. You're going to impact them. So you've got to kind of think big picture from a value chain perspective, enterprise wide, to make sure that your project is not in conflict. It's in synergy with the other things we're doing. And then kind of the last couple of pieces are more important to kind of long term here, right? So where does this investment rank, right? So if we are coming with this project, where does it fall in lines of priority? Is it something that is absolutely needed, like, so for example, a mandate that's required? Is it something that's, hey, this is a new product and we want to try to explore our sales channel? So there's different pieces and parts. You want to make sure that it's the right level, so it gets the right attention. And then finally, once the initiative is approved, so once we've gone through our requirements, once we've understood what the cost is going to be, once we understand a technical solution, and we implement, who's going to be ultimately responsible? Who's going to own the product? Who's going to own that service going forward, right? Because it doesn't do a lot of good to roll out a project or a product that then just kind of lives by itself and has no oversight and any sort of management. So I think the key is getting through. If we can cover those questions when you're making your decision making, you're going to be in good shape.
Yeah, we had I remember one initiative that we did, and we were asked to actually stand up a bank for a health plan. Everything from brick and mortar up, and I mean, it was establishing red flag programs, customer service integration into the health plans. We got it stood up. We had over 1,000 accounts, and soon after we had the accounts, we were told to basically tear the bank back down. We found out that there was no executive sponsorship who wanted to maintain and own that on an ongoing basis. So it was just a key example of where some of this upfront legwork wasn't done, and it resulted in kind of a failed mission.
Yeah, I mean, great idea, right? Good plan, would have helped the health plan out. Just didn't have a lot of sponsorship.
That's right. So I think it's your slide.
Oh yeah, I'm sorry. So now that we've talked at a high level, we're going to start to get into the details a little bit of how the methodology would work, right? So the next couple of slides are going to talk through how we step through the methodology and some of the pieces and parts that are important as we get to more in the detail here. So for this exercise, let's assume we have a large organization that consists of many different business units. So again, payers or hospital system would be a good example. Each business unit has a strategy that aligns to one or more corporate objectives, right? On top of that, each business unit has, ideally a set budget for their project work, right? And a list of projects we like to push forward. And granted, I know I'm kind of talking heavy path a little bit, and that, some places may not have roadmaps, some may not be as mature, but at the end of the day, ideally, whether they call them business units or verticals or service, components, they're different pieces and parts that work together to form the whole business, right? So one of the things when you start something like this is each initiative should be evaluated against each of these business units and that corporate strategy, right? So our guardrails, our business objectives. Once we have that alignment, then we can be more tactical, right? Then we can start to uncover, some of the rocks, look, kind of in the weeds a little bit and start to understand more of what we're after. The business from the beginning is going to want to have an idea of size, right? So they're going to want to know, roughly, a rough order of magnitude. And you may have heard the term T-shirt size used in kind of from agile methodology perspective. So, right, a small, medium, large, or extra large, right, to kind of give an idea of how big we think the effort is. The business unit then has to look at these ideas and prioritize them against their budget, right? For, whether it's strategic significance, compliance, regulatory considerations, pet project, whatever it is, right? But we've got to make sure that the prioritization there and the idea is there and driven, in one kind of direction. An example of this is the state or federal mandates, right? So even things like HIPAA mandates or anything like that, that's going to take precedent over other items that may not be mandated. So we want to add, a new cost share value to our benefit plans. Well, that's great and all, but the state has indicated that we have to, add this, note to every single, explanation of benefits. That mandate is going to take precedent over that essentially product that we're building. And that's going to, that prioritization is going to allow for some pretty key initial decisions, right? It's going to allow us to rank, most least important initiatives. So if we think we have a stack of a dozen initiatives or so, some are mandates, some are ideas, some are follow-ups, phase twos. This will allow us to kind of manage that and kind of balance that a little bit to make sure we're hitting our corporate objectives and aligning with what we want to do strategically. But it also kind of lets us defer our least important initiatives, right? So there's only so much time in a day, only so much work that can be done. So at the end of our decision-making process, at the end of this process, what we should have is a ranking of most to least important, deferral of initiatives that we don't think we need to do right now, and then a list of ideas to further evaluate. So some projects may spawn additional ideas that may not be doing right now, but they're something we can look at for the next year.
And coming out of this process, what the goal is to really develop a detailed business case, also called a project charter. It's a really important step because it requires us to dig in at the next level of detail. And so it should clearly lay out this business case, who are the stakeholders that are going to be accountable for the overall success and failure of this initiative. And they'll be there to help provide guidance. If we're not sure where to go at a particular point or what the intent was, they can help provide that guidance through the entire life cycle of that idea. And then, just as importantly, if not more importantly, as we run into roadblocks, they can help remove those roadblocks for us. So some of the fundamental, components of a charter or the business case, include the initiative stakeholder. Again, we need somebody who's going to be willing to go to bat for this initiative and own it long term. The initiative goals and objectives. So if we're successful, right, with this initiative, what are we hoping to realize with delivering on this idea? And how does it align to the business unit strategy and corporate objectives? What's in scope and out of scope? So this is going to help set the initial guardrails for us. And it's actually a really critical component later in the process when we move into the estimation phase. And then the key assumptions, as we understand these key assumptions and document them, as we go through this evaluation process, we're going to look to validate or invalidate as many of those as possible. A single incorrect assumption could result in a pretty massive swing in terms of time, money, or resources. So it's really good to get this documented. Risk dependencies and constraints. So at this level of in the ideation phase, any risks, dependencies, or constraints we know of are likely to be super high level, right? Because we're not quite in the weeds yet. But the more we know ahead of time, the better, right? Because we can plan for them and look out for them as we go through. The rough order of magnitude, which Thomas, you covered. Estimated duration. So similar to rough order of magnitude, how long do we think this thing's going to take? If we had all the resources to bring to bear and we had no barriers from a resource perspective, how long do we think it really would take? And sometimes it might be we need to have this by a certain date, and so that date defines when it's going to be needed to go live, and that actually could later then define capacity. And then impacted areas, systems, and processes to the extent known. We want to know what are the areas that are going to be impacted, the functional areas and operational areas, and to the extent that we know, what are the systems that we think would be potentially impacted and/or processes, and then the expected benefit, Thomas, which I know you covered a little bit about, but this is different from the goals and objectives in that it's we actually try to quantify here, if we're saying, hey, the goal might be, I want to improve customer retention. And we say that this idea is going to, produce a 5% improvement in retention. Well, that would equate to X dollars in revenue, right? Just from retention. So being able to actually get down to a quantifiable number that we can later go back and track. So, your charter, you may have charters that you guys use that include other items as well. But the key here is, reducing as many of those potential holes in the bucket as early in the process as we can. So, Kenan.
Hi, everybody. Just putting the polling question up on the screen. Have you or your business ever experienced a project failure?
And if the answer is no, can you, whoever that is, you send me and Matt job offers?
Yes, it's 100% yes. So there we go. Yes.
Oh, well. I'm gonna keep working here. It's fine.
Yeah. All right, there you go.
Excellent, thank you. Trying to,
Next slide is it?
it's not going to the next one.
Click on it.
There we go.
All right. So the next piece here is now we're starting to get into kind of where the rubber hits the road. Okay, this is the rapid evaluation process. So the first part of this involves, a lot of different resources and really an attempt to start to peel back the, layers of the onion, right? So as Matt went through kind of the artifacts, the charter being, or business case being the first kind of step of input. When we receive this documentation, right, intake can be, a myriad of different methods, whether it's email, SharePoint site, wherever we want to, hand deliver, a charter. But we'll want to work with the stakeholder to identify the kind of the key points of contact for the impacted areas, systems, and processes. Again, the pieces that Matt mentioned. So the point of this is really to make sure that you're getting as much coverage as you can for this upcoming evaluation. You're not going to get everybody. There's going to be one or two people, one or two areas that are missed. But the idea is you're getting 80, 90% of the impacted areas and systems and processes together to discuss the change that's coming up. Once you kind of have that identified, which will be kind of part of the charter process and the business case process, we'll schedule a working session with those stakeholders, those leads, to walk through kind of the end-to-end value chain or a functional map for that organization. The idea being that we're going to highlight key functions, systems, and processes to again start to kind of validate that larger effort, right? To make sure we're accounting for all the different touch points of the change that's being requested. From there, we'll collectively review the charter and business case based on this, right? So we'll detail specific impacts that reside in the functional map. So for example, as we're looking at this functional map and a project charter comes through, it may be heavily impacted on enrollment or claims. And that's, what we want to really make sure of when we validate this stuff, that as the idea is formulated, we understand the main point, but what does that mean for the rest of the organization? What do those impacts lay out, right? We can't just focus on the change or the change agent, but really all the different pieces and parts of the organization that are impacted. This is a facilitated session. So this is absolutely like a, just like any other kind of status meeting or anything else, right? Where, it requires a facilitator to understand the subject matter and pull, elicit functional and technical needs, otherwise known as requirements, right? For those known impacted systems, functional areas, and processes. So, that's, but, the goal of that, the value of that is by walking through the end-to-end value chain, we're ensuring that we're turning over all the big rocks, right? So we're looking at across our organization and making sure that, again, the bucket that Matt showed has less holes in it when we get to that point, right? This will give us, kind of a visual representation of the scope of the initiative as well. Allows us to kind of validate our assumptions or even bring up new assumptions or concerns that, we may, uncover as we review with the stakeholders, right? There may be things they didn't think about that, our facilitators would think of and say, oh, you don't forget about these people. So through the working session, once we're into the actual working session, it's really important to have a scribe or an analyst or someone that can really take notes, right? Capture the requirements in real time, capture follow-ups, because, the facilitator is going to be kind of in front of the room or in front of the camera, driving everybody, herding the cats, if you will, to the answer. So you'll need somebody as such a partner in crime to document, the key things that are being pulled out of the evaluation session. Following the session, the idea is that we would then work with these impacted areas and systems and process owners to understand the resource needs, right? So we're going to come up with these ideas, and we're going to have a way to execute it. And this is going to help us understand how big of an effort this is, right? Do we need 3 people from accounting or just 1? Do we need 4 IT resources? Do we need just 1? And try to get an idea of the impacts. It'll be refined throughout the process, but for this initial facilitation session, you want to kind of start to understand the structure of the execution team for the initiative. From there, you'll then review the requirements with your IT partners, right? So again, this initial facilitation where you're dragging out the requirements is very business focused, right? Very subject matter expert focused. Typically don't want to have IT involved at that point because they're going to want to jump to the details and architecture and solutions, and really you're not at that stage yet, right? You're just at understanding what it is that we want. Now, the next part of this, once we've identified requirements, is working with our IT partners to obtain like a high level of effort and a time frame for implementing requirements, right? So we've gone away, we've talked to our whole organization, we've got everybody's input on what we need to do for this new product. Now it's more about getting to IT and say, okay, is this doable? Are we down the wrong path? Is this something we can do? The goal here is it's going to raise our confidence level on our initial rough order of magnitude and t-shirt size that we spoke about earlier, right? So earlier we said, hey, it's a medium-sized t-shirt, or it's it's a year's worth of work for $1 million. Now we have our more detailed requirements. We have the other side of the coin, which is the IT piece of it. So we have their estimates and resources. And that's going to give us a total picture, a reasonable understanding for the estimated cost and delivery of this initiative. And then, now that we've got those 2 pieces, we've got all our detailed requirements, our cost. We'll work with the financial team to establish the expected benefits. So essentially the ROI. So, how much is the cost going to be year over year? How much benefits are we going to realize, whether it's a PMPM perspective or a licensing perspective, but whatever those benefits are that we're going to see in the project. And again, depending on the organization, this whole process should take about 4 to 6 weeks. At the end of it, the artifacts will have our cost breakdown, we'll have our benefit commitment analysis, we'll have our program execution model, we'll have our our milestones for implementation, and we'll have our requirements document.
Hey, Tom.
Yes, sir.
A quick question for the 2 of you. I've seen historically, and I'm just curious how someone can. I think there's sometimes issues when IT oversteps or takes over a project or initiative, and suddenly the business owner either started because IT owned it and should have been owned by the business, or vice versa. Business owned it and then IT took it over and it took a little bit longer. Can you share a little bit of ways how to pull that ownership back? Or is it an issue that had to be dealt on very early in the strategy phase, even before this? Just would like a little bit of tools or insights or recommendations on that. How to pull it back.
Yeah, that's where that charter piece, that initial review of the business case and the charter are super important. That's where you're establishing that pivot that you're talking about, Ken. And so, ideally, when you're reviewing that business case or that input from and you realize this is an IT project, this isn't a business project, that's where you'd make that call. That's where you'd kind of establish with the executive source, hey, this is a great idea and we really need to do this. But I just want you to let you know, this looks like more of an IT kind of, market competitive thing, or, a technology thing that again, totally fine, and we need to pursue it. But you're getting their mindsets around more like, this is not an enterprise thing, this is an IT thing, or this is a business only, there's no IT, it's just operational. So it goes both sides. But that's that initial charter business case review is where you flesh that stuff out.
There's that, and the other really key, which is part of that charter, is back to having the executive stakeholder who is going to be overall accountable for this, and that shouldn't change through the life of this idea, right? Whether IT is involved or not, and we try to focus that on a business representative.
Yeah, and there will be IT stakeholders, right? So we talked about IT taking over, and that was when I mentioned actually doing the facilitation session. And we'll get into more of the details in the setup. But if you envision, I've got my accounting person, I've got my claims person, I've got my product person, I've got my enrollment billing person. if IT's in there, and again, not bad, I'm an IT guy, so I'm not in any way bad mouthing, but if they're in there, they're going to want to instantly know as soon as something's spit out of an idea, they're going to want to know how they need to solve it. They're going to say, well, you can't do that, or they're going to say, well, we can do that, but it's this system, and they're going to take you down another path. And so we've built this to specifically focus on the business first, really understanding what they want first, and then working with IT. It's absolutely a possibility that when we get to IT, they're going to change stuff. They're going to go, I get that you guys want this, but you can't do it that way, or it's because of security or because of these GDPR rules, we can't do it that way. And then you have to kind of pivot. So a good example of that is when we've done our session and we've got our requirements, we've got all the pieces. We go to the stakeholder now to get to present this information, right? To show them the charter, the requirements, the IT solution, the benefits, the cost, everything else. And that's where they make their decision to, defer. Without this process, think of it this way. So if we had imagine if we had a stakeholder that had an idea that initially when they thought the idea, they're like, it's going to cost me about $1 million and it's going to be delivered in a year and I'm going to get my investment back in 2 years. Well, normally that goes on and the reality, none of that would be realized until the project was done. Well, sometimes the reality is that when you come out of the rapid evaluation, the stakeholder learns that, oh, actually my idea is going to cost $2 million. It's going to take 1.5 years to deliver, and I'm not going to get my money back until 3 years later. So now maybe all of a sudden that idea doesn't look so great, right? And so that's the idea, because without this type of layer or this evaluation, what happens a lot in organizations is this project's going to get greenlit because Matt wants it done, and Matt's the director, and he said this is my idea and we're pushing it forward. Well, this project gets assigned resources and it goes off, and there's some requirements that Matt provided, and they go through the normal methodology of building software. Well, now it's 2 years later, and it's $1 million more than Matt thought it was going to cost, and it's not half of what he actually thought it was going to do. So this process would stop that, right? And not stop it, but in the sense of cut it off at the pass, instead of waiting for 2 years to realize, oh crap, we've gone over budget and now it's too late and now it's not as cool as we thought it was. The idea is you're putting that decision making up front so that there's ownership at the executive level to really understand what they're signing up for and make that call.
Yeah, and Thomas and I actually implemented this methodology for a large healthcare payer. And we found that every initiative they had to come through us, right, and go through this process. They killed 50% of the initiatives before they ever went into execution. So, what we'd see is where they would just go execute on it for a year and later shelf it, right? Because they missed the market opportunity, or, similar to the bank that we stood up, it just didn't have executive sponsorship. So we actually saw where there were a lot of savings just up front by, spending some time early on and avoiding that waste down the road. And so, I know, like, we've been talking very much at a conceptual level, asking you guys to kind of imagine a bunch. So thought it might be helpful to walk through kind of a practical example. And so, for this example, let's assume we're supporting a super large healthcare payer and they're interested in developing some new innovative health plan design. So we're just making this up, but, let's say that the plan design has a multi-tiered network and a different cost share model, for each tier. And so then based on the charter that was brought forth, this product idea, we identified product, underwriting, benefit config, billing and enrollment, compliance, claims, marketing, and member provider services as kind of those key impacted areas that we'd want to actually bring into this rapid evaluation. So along with the facilitator, we'd have a scribe that's capturing those requirements. And so for this example, you be the facilitator, I'll be the business. So I'll play one of these 8 different roles. And then we actually have an imaginary friend named Sunny, who's the scribe, capturing the requirements as we go.
All right, so the first thing we'd want to do is we want to start aligning the charter scope, right? So if you envision kind of, meeting kicking off, the first thing we're going to do is spend 30 minutes going through the charter, okay? Understanding what it is. Ideally, the folks that are there or participating have done some pre-reading, but 9 times out of 10, they maybe won't. So you're kind of reintroducing what's in the charter, And really what we're establishing with this group is we need a product that provides 3 tiers and respective cost share models by tier. Me as being as facilitator for this example, I would then work with the business to understand what that product development process and impacts mean. And so so as we go through this, we're going to play. I'm going to be facilitator, and Matt's going to be the different SMEs. I should have like a fake mustache. So I'll pretend. So it'll be weird because I'm kind of talking like as I'm talking to a room full of people. Really, it's just Matt here and our fake imaginary friend Sunny. But so the very first step, right, is, and again, a lot of this material that you're seeing would be kind of, built out on either visible to the participants or on a whiteboard in a room so that they kind of are following along with the topic areas. But what we first need to understand, as I'm in facilitator mode now, is what's the very first thing we need to do to develop this new product?
And then me being the product SME in the room, again, all of these 8 SMEs are in the room. So me as a product SME, I'd say, well, the first thing we need to do is define the product. And, in order to define the product, we need to talk about things like what's the network strategy? What are the benefits? What are the respective limits for those benefits? What market are we going to sell this in? What type of product is it? And those sort of things. And so the first box you see, define product, I basically threw that out as being the first step and the key things that needed to be identified there.
All right, Matt, that sounds great. So part of defining this product is we need to figure out what type of product it's going to be. Are you guys envisioning this being an HMO, an EPO, PPO, point of sale?
It's actually kind of a hybrid HMO and PPO.
Okay. Well, what do you mean by that? What is a hybrid HMO and PPO?
Well, I kind of envision, cost share models that include both HMO and PPO components.
Okay, that makes sense. So that's fairly complex. Let's maybe circle back when we get to that when we talk about cost share details. But continue with the product. What sort of markets are we going to try to sell this product in?
It's intended for commercial, individual, and small group.
Okay, so everybody basically. That's great. So. Now, are we thinking this product is going to be limited to medical only, or does it include ancillary and specialty benefits as well?
This is for medical only. We're assuming that ancillary would be, a buy-up or a carve-in, and they would have their own cost share methodologies.
Great. And Sunny, make sure you're please capturing all of these details that Matt is laying out so we can review them at the end and make sure we've got everything captured. So Matt, what are the network variations per tier and kind of what are their respective limits?
Yeah, so we're thinking like tier 1 would be more that HMO framework. So as I mentioned, HMO and PPO components. So it'd be, they could use the HMO network and they'd have to get a referral from their PCP, and then they would be assessed a copay cost share. And tier 2 would be use any network provider. And if it's without a referral, you get a deductible or co-insurance cost share. And then tier 3 is more of a narrow network strategy. And if you see a particular physician there, you pay an annual fee and you have unlimited visits.
Interesting. Okay. So I think I'm starting to get it. So could a provider be in multiple tiers? And then if that's the case, how would we know what cost shares apply to those tiers?
Well, provider could exist in both tier 1 and tier 2, but if the member has a referral from their PCP for the visit, it should be adjudicated based on a tier 1 cost share.
Okay.
But if they don't have it, it should be don't have a referral. It should be adjudicated based on a tier 2. So the PPO components. But no tier 1 or tier 2 providers should be in the narrow network.
Okay. So Sonny, let's make sure we capture that. Those are really important details, and they're going to really drive kind of how we price out the product and everything else when we get to that point. So Matt, what are the limits for each cost share by coverage tier?
We haven't quite figured that out yet. It's going to be something we need to work closely with underwriting and actuarial on to make sure it's a cost effective.
Okay, that's totally fine. We're not going to solve everything today, right? So what we'll do is let's make sure we capture this as a key open item. And then if we could get someone to volunteer to take this to underwriting actuarial or to reach out to underwriting actuarial. And if we could try to apply some, end of date on this, and maybe like by Thursday, we can have our key inputs into the benefit analysis that we'll build later.
Yeah, you can put my name on that as an action item, and it shouldn't be an issue to have by then. Both actuarial and underwriting, they're aware of it and have already been given it some thought.
Awesome, awesome. All right, so now scene's over. We're back to Thomas and Matt. You kind of get the picture of how complex health insurance is, right? That was a very specific example. We went into the weeds, and you can see how you could spend more than an hour alone on just that first product definition setup. But in the interest of time, for us, we're going to move to the kind of the next step. So really, if we kind of envision, we've gone through all the product pieces that you guys are seeing on the screen. So we talked about marketing materials, we've talked about, configuration of templates and that kind of stuff. The next piece here is, we're going to, configure the product, right? So now, again, I'm back into talking to my group of friends and say, okay, guys, we've now defined the product. What's the very next thing we have to do once we've defined the product?
So me wearing a benefit configurator hat now, I would say, we need to configure the benefits. And so we would need to create a benefit package. And in order to do that, we need to create a new benefit category for that tier 3 annual fee, because we don't have that in our systems today. So we'd also need to figure out, how we can see that annual fee is being paid monthly, and or is there a process for missed late payments or a grace period or something like that?
Okay, so Sonny, did you capture that requirement around the annual fee benefit category? Sure did, Thomas. Okay, great. All right, now, are you referring to business rules when you say that stuff, Matt, or are these things you need to configure on some sort of platform?
Well, yeah, we do need to find the business rules and the grace period, but I don't do that configuration. I think that's handled in the enrollment and billing area.
Perfect. And that's a great point. And so we can park and let that item until we get to the enrollment billing part of the process. Sonny, can you make sure we earmark this, and so when we get to enrollment billing, we can kind of go back through this. So again, you're starting to see kind of how you kind of take on the next components. Really, as I mentioned before, you're going to kind of chunk each one of these boxes through, right? To just really check them off to make sure there's no impacts. It's very possible that some of these areas may go, oh, no, we're fine. There's no change for us. This is something we already have hooks in. We already have variables in for this. We don't have to do it. But the next, but as you get into the other components, right, we've gotten past product. Now, we're into the product details. Now we're into our group and member enrollment, right? So we're getting into underwriting, what the price of the benefit's going to be, what the product's going to be, any exceptions. So are we going to have governance that kind of drives this product from a purchase perspective? From a group and enroll perspective, are there accumulator changes, which clearly in this case for our network tiers there would be. Is billing going to change? Do we need new ID cards for this new product? So there's so many different pieces and parts in the value chain. And then from there, now you're getting to servicing the employees, right? So you can see from this graphic here, you've got our providers, we've got our members, and we've got our folks. The provider's going to submit the claim. The member's going to value that, or, take the service or submit the claim on their own as well. But again, this all connects to our different portals, our customer service, IVR. All of these folks are impacted by this work, right? So this is a new product that's going to come down that chain. And every single one of these things may have an impacted area that they may need to tweak, to fit in this new product. Good.
Yeah, and I was just going to say, this is an example where, we started off this discussion talking about the ecosystems colliding, and this is a perfect example where you're seeing the provider, the member, the employer, the broker, right, and the health plan, obviously. So, this is an example where you're actually looking outside of your own ecosystem as well, and considering the impacts to those particular touch points.
Hey, guys, 15 minutes. Just
yep. And good timing, Kenan. You're on.
Yeah, perfect. Next polling question. Launching it now. What is a value chain functional map? Instructions for how to complete a business case. The mapping of an organization's key functions from end to end. A map depicting how a bicycle accelerates.
Can we vote, Kenan?
Yeah. Yeah, great. A map of the organization's key functions from end to end. Okay.
All right.
I like the honest answers.
Yeah. All right. So we talked about the artifacts. I'll try to run through this pretty quickly, but the high-level business requirements is absolutely a key artifact that comes out of this process. If you recall from the example walkthrough, Thomas was asking Sunny to capture a lot of the requirements that we were talking about. It's over a 2-day working session with this group. It's not uncommon to come out of there with 10, 12 pages worth of requirements that then need to be put into a more structured format, clearly laying out the functional versus non-functional requirements, and try to flesh them out as much detail as possible over that 4 to 6 week period that we were talking about. And so, as you can see here, what high-level requirements are talking about is what, it's really uncovering the what a system or solution should do. And, when Thomas was talking earlier about, IT involvement, they really want to focus on the how. So that's why we want to avoid that initial upfront. We want to understand what the business needs, and then we take it to IT to describe the how. And so, based on the example we walked through, we said we need to create a new benefit category and accumulator values for annual fee, right? So that's the high-level business requirement. But then some of the non-functional requirements might be the new benefit category and accumulators need to be available selection for all benefit configurators on all platforms, right? And so that's talking about the availability. So that's an availability requirements. Other non-functional requirements might include data, usability, security, performance, reliability, supportability, and just as importantly, what's out of scope. So those are some of the key things in a high-level business requirements. Some other key things that we want to include are use case workflow diagrams. So sort of that diagram that Thomas was walking through. What that does is it helps provide a lot of context for people that weren't actually in the room when those requirements were dictated, right? So by including those in this document, any reader can pick it up and kind of level set on where you are within that ecosystem. And it actually takes a lot of the interpretation out of it. The in scope, out of scope, back to that guardrails discussion. Why it's really, really important at this point is because we take this business requirements, we go back to that stakeholder to say, this is what's being delivered. Do you agree? Do you sign off? And once they sign off, it's in the books, right? So now it's a project manager or program manager's job to manage within those guardrails of what's in scope and out of scope. So you sometimes hear scope creep, right? That's one of the key things. If we have it documented, signed off on, then it helps prevent any kind of scope creep. We talked about key assumptions, but being able to document key assumptions in this document, any known dependencies, which we'll have a much better feel for at this point than we did at the charter development. And then stakeholders' approvals, as I mentioned, is absolutely key.
Right. So Matt talked about the requirements and kind of the main guts of it, but there's supporting structures that are important, right, to make this successful. So one of the things is an execution model, right? So we talked about early on, key subject matter experts involved in the requirements review and the charter review. We have our executive sponsor, but really, and again, this is germane to our example. It would obviously look different depending on the organization, but really, what you're trying to establish in the execution model is who your executive sponsor is, who's going to really be your kind of your hero when you need additional support or you need escalation. That then kind of rolls into the steering committee, which is really made up of your key stakeholders, your change control review board. So as scope changes or questions come up, that steering committee will make those decisions. And then they're being fed from our project delivery tracks, right? So in the case of our network tiers, it's enterprise-wide initiative. So our Northeast, we need somebody to handle our Northeast business. We have somebody to handle our West business and our Midwest and Southeast business. So in each one of these cases for this example, these are individual components. But the idea here is that you're identifying kind of group project management to make sure that your entire process is covered, because you're going to have different changes depending on what system is being implemented. Okay.
Yeah, the only thing I was going to say is with the idea too is outside of the steering committee and potentially the executive sponsor boxes, every box should have a single name in it, right? So who's accountable for this area to drive the successful execution? And so again, to Thomas's point, I mean, we just threw this together as an example, but it would look very different depending on the organization. But again, the idea is to have a single name per box, and this everybody has roles and responsibilities defined, the meeting cadence and is determined. And then this even helps facilitate the communication plan as well, how communication is going to happen within the program.
Yeah, because that impacted functional areas below is key, because that really represents your SMEs that kind of gave you your inputs. And what you don't want to do is you get together and then everybody disappears and then nobody can follow up or nobody can kind of clear anything out. So you still want to have the identification of who those folks were, so you can kind of constantly get back to the process is done.
Continuity.
Yep. So the next piece here is this is our kind of this is a sample benefit analysis model. So again, this is going to be very organization specific, right? Most are going to have their own type of financial impact tool. But in lieu of that, we have a kind of an all-encompassing benefit analysis model. Really, the idea here is that from your requirements, from your charter scope, you're identifying what your benefit drivers are, whether that's cost savings, whether that's new enrollment, whatever it is that benefit you're looking for. And then working with underwriting, finance, and actuarial, you're identifying a high-level estimate of those benefits being realized, right? So it means we're going to get 1,000 new members this year. That's going to be $500,000, right? Or whatever that is estimated wise. So you capture your benefits, and then you have your costs from IT in the business and what that expected to be. You drop that in. And the idea here is you're getting your picture as you go to your executive of essentially how your benefit analysis model looks, right? So, how much are you spending? What are you getting out of it? And again, there are millions of ways to tweak this. This is a pretty straightforward example. But yeah, I mean, again, this is something that gets part of the decision-making process.
Yeah, and we've also seen this used in many different ways too, right? So like we've seen where businesses, have pulled this artifact together as part of the package that goes back to the executive sponsor for a decision. But then if the executive sponsor says, yes, let's move forward, the overall organization may say, okay, well, that's great. You're signing up for a $2 million savings. So we're going to actually take that out of your budget next year. Right. And so like we've seen it used more as a benefit commitment, right, versus just an analysis. So there's a lot of value in this particular artifact as well. And then Kenan, last question for today, and I think we can wrap.
Yeah, great. Thank you, guys. Here we go. Polling question. Can you think of any current or previous initiatives you've been involved in with a methodology like this would have worked? That was a quick answer, everyone. Yes, yes, yes.
Excellent. Well, any questions from folks before we adjourn?
Let's move to the last slide. So you guys, this is, thank you for joining, and thank you guys, Matt and Thomas, for that. That was, I love that. I love that amount of data in such a short amount of time. So thank you. On the screen, you all as the contact information. If you have any questions, that you can write us to us directly or write to our partner at rgphealthcare.com. Really appreciate the time that you all spent today. We will be sending out that information. Here is a question. What do you find is the most common reason that healthcare leaders fall short in this area when the failure rate is so high, as you noted?
I don't think there's one single reason, but I would say that for me personally, I think the lack of accountability is a huge one, right? Not having somebody to hold their feet to the fire is a big problem.
Healthcare moves, it's weird. It moves slow from an innovation perspective, but fast from a reaction perspective, right? So there's things constantly changing in healthcare, right? But in a lot of cases, it's such a monolith that it's really hard to really enact, hard change. And so a lot of times, we'll see, the request will come through. It's like, I gotta have this, I gotta have it fast. And really, it just doesn't, in the big picture of the way the market's going, it's And
part of that is it's also often very siloed, right? And so a lot of people we talked about synergies and conflicts, right? Is this initiative conflicting with something else, or is it, is it synergies with other initiatives? And by not uncovering that early, it becomes problematic too, right? So there's back to the holes in the bucket. There are many reasons to have holes in the bucket, and I don't know what would be the most common to answer your question. I apologize.
Great. Again, if anyone has any questions, please email them. I'm going to turn off this recording.